Have you had a friend or a relative, a family member that died from sudden heart attack? Have you been experiencing, chest pain that's been resistant to ulcer treatment? Have you been having chest pain that is triggered by exercise or even doing little work, or triggered by cold, in cold environment, and you're not an asthmatic patient? I think you need to listen to this post. I'm Dr. Chisom, as you all know. Now, in this post, I want to talk about chest pain, central chest pain. Now, we all know, we all experience once in a while different chest pains. True chest pain can come from different causes. There are less dangerous causes, but there are very dangerous ones that you must rule out when you're having chest pain. Now, your chest pain may be coming from the musculoskeletal area, that is from the muscles or the skeletons, your ribs area. It can be coming from, also if you're an ulcer patient, or it can also be coming from, the lungs if you're having pneumonia. However, there are even more dangerous ones that, we really have to be sure of. You really have to be sure it's excluded when we are playing with chest pain. Now, if you've been having chest pain that, when you climb stairs you experience, and then when you relax you get better, or when you have emotional outbursts, like when you get angry or you're too fearful or anxious, you start feeling this chest pain, or most times when you pass through a lot of stress you start feeling the pain, and then it gets relieved on rest. Well, you have to really watch it, because there is this chest pain we call angina, which is coming from the heart and which can be very dangerous. Now, initially, it can start with stable angina, means that it may really start, and then when you rest, you feel better. But as you go on, it may really get worse, and it's not even relieved again by rest. Now, this is the dangerous point that you have to be very careful of. If you've been having chest pain like this, the tendency is that your blood flow to your heart is being affected, and so because of that, when you do a little work, the heart senses it and then starts feeling this pain. It's not receiving enough nutrients because of the blood flow compromise, and because of it, it starts feeling this ischemic. We call it ischemic pain. That is pain because it's not receiving what it's supposed to get, especially when you work hard. Now, how do we make sure that it is not from this kind of very dangerous? Now, it's very dangerous because it may continue over time, and then it keeps occluding this part and continues occluding it, that it gets to a point where even when you rest, the idea is that when you rest, the load to the heart is reduced, and then the air the blood flow is reduced, and then you come back to normal. However, as this progresses, it may get to a point where even when you rest, you don't get a relief. So you have to be very careful when you're having this kind of chest pain. You have to rule out angina, because it may in the long run progress to unstable angina, and subsequently to myocardial infarction that can lead to, in a layman's term, cardiac arrest, that is heart attack. So if you've been having this chest pains, and then you've taken all the ulcer drugs and it seems not to be working, and you've taken all the other drugs too, you've done your echoes, and most times you've done a chest x-ray and nothing could be found, it's very important that you do this test that I'm sending out for. You have to be sent for an ECG and an echo. Now, this is not the normal ECG and the echo that we all know. There are specialized type of ECGs and echo that this group of people have to do. We call them stress ECG and stress echo. Now, the idea of this stress ECG and stress echo is that it tries to paint a picture of your body working hard. Now, it tries to mimic that picture. It gives you a drug that will try to increase the heart rate, the workload on your heart, and then we now study your heart's response, your heart activity in these circumstances. Now, most times, if you do the normal ECG and the normal echo, you may not see anything, and it may just be a waste of money. So, if you're having this chest pain that you're really worried about, you have to be sent for a stress ECG or a stress echo. It will most likely be more useful in diagnosis of angina. Now, it's very important that you not just stop this post at your doorstep. You have to circulate it, because a lot of people are dying from sudden chest pain. They'll tell you they're having sudden heart attack, and then next thing, they die off, because over time, they have not really found out what was really causing it. Now, if you learned a lot from this blog, I don't just want you to help. I just want to restrict this information to yourself. A lot of people are dying suddenly, and we just, cry over it and moan over it, and we don't try to find out the underlying cause. Please, if you love yourself, if you love your neighbors, if you love your friends or your family, it's important that you take this information serious. I remain Dr. Chisom. Thank you, and keep watching Vetwell Niger.